Is this relevant to me as a doctor? You would ask. Well, yes, it is. Because if you're a doctor, nurse, paramedic, hospital lab, or healthcare provider, and you're seeing patients, specifically if you're seeing patients online via telemedicine or apps or SMS, your phones, WhatsApp, those days also we used to use a telephone and tell a guy, okay, have an aspirin and come and see me tomorrow. That's telemedicine. If your hospital has electronic patient records, if your clinic provides data to insurers, hospitals, labs, etc., on online applications, then you very seriously need to start thinking about online security and privacy. Now, patient record protection is a very serious point. Please understand that there are strict laws for data security. Now, if that data, the data of the patient, is lost, we're talking of things that happen all over the world. Data loss can lead to prosecution. It can lead to heavy fines and or imprisonment. It can obviously lead to loss of credibility and brand image. Imagine yours is a very famous hospital and we find that somebody has hacked your system and stolen hundreds and thousands of records. Imagine the credibility. You're going to take a real hit. Also, thanks to technology these days, you can be blackmailed via ransomware. A guy can lock your records and say, okay, I'm going to ask you to pay me so many millions, only then will I release your records. So all of this is something which is terribly, terribly awful and needs to be looked at. And that's the reason patient records need protection. There are lots of healthcare data protection laws globally. I mean, I'm quickly going to go through these because we have limited time. We have the famous HIPAA of the US. It's the Health Insurance Portability and Accountability Act, which ensures accountability of records. And there are a lot of fines and there are a lot of other actions that can be taken against a doctor, irrespective of where he's in the world, as long as he's handling US patients. And he could be fined, that organization could be fined, he could also be arrested. We'll come to that a little later. You similarly have PIPEDA, we have GDPR in Europe, you have PIPL in China, PCEHR, the Health Information Privacy Code in New Zealand, and so on and so forth. All countries have their own versions of health data protection laws. It could be, combined with the general data of patients or of people, for example, like GDPR, or it could be specific to the patient records alone. There are different levels. They could be focusing only on certain data of a patient, which are, say, protected health information, or it could be all the data of a patient. Does not matter. There are laws protecting data records of patients globally. Now, there are a lot of penalties. I'll give an example of HIPAA. You could have, tiers, different tiers, starting from as little as $100 to as much as $1.5 million, depending on the number of incidents and the type of incident. In fact, you could also be criminally taken in, and you could have anywhere from 1 year in prison to as much as 10 years in prison. And that could even mean you in India or in some other country if you're, providing consultancy to patients in the US. Just an example. Now, these penalties are very real. They are just examples. You can see the numbers. This is for 2021 in the US. And in 2020, it was almost 13 million. So that's a very large number. Moving ahead, like I told you, there are prison violations, and these are examples of where people have been given 48 months of jail, somebody's given 3 years of jail. Then there's a dental practice where he's spending 2 to 6 years in jail. And here's this gynecologist, Rita Luthra, 65 years of age, who's been sentenced to 1 year of probation and has permanently lost a license to practice. So it is very, very real. And it could also apply to doctors in India. Now, what are the data protection laws in India? We also have a number of laws. We have the Information Technology Act, which started in the beginning, which looked after all data which flows electronically. Of course, as you're aware, the Medical Ethics Regulation of the Medical Council of India, which is now, of course, called the National Medical Commission. has a code of ethics, which talks about security for the patient's records. The IT Act then had a section 43A and section 72A put up, which talks of compensation for failure to protect data. As far as hospitals are concerned, we have the Clinical Establishments Act, which mandates maintenance and provision of the electronic medical record for every patient. Then we have the EHR standards, cell medicine practice standards, Let's move ahead, just to let you know that these laws are real. But are we in India relatively safe? No, we are not. Here's an example. Just 2 days back, hackers stole the hospital data from Mysore, this hospital Mysore, and want the ransom to be paid in Bitcoin. Fortunately, they had kept backups and most of the data came back. Moving ahead, let's come down to the actual core of what we need to understand. How do we protect ourselves? That is important. How do we protect our patients? Now, if you're an institution, a hospital, a lab, an imaging center, a clinic, a nursing home, etc., these are the things that you need to do. First of all, you need to review what you do. If you or your staff are using only paper records, then you're probably safe from electronic threats. Otherwise, if your workplace uses any kind of computers or any software, even MS Word, for example, get a review done by a healthcare informatics security specialist. He will be able to find out as to what is right and what is wrong and help you secure your records. Lay down physical, hardware, software, barriers to prevent unauthorized access to departmental devices. Ensure you have an IT department, either local or outsourced, to maintain these systems. Ensure you have antivirus, anti-spam, anti-malware, and the works, which would protect you. Always remember, backup. Use encryption, complex passwords, train and retrain your staff, because many a time you see it is your staff which is the weak area. They tend to casually go around saying, hey, please use my password, go into my system and do . That is absolutely not acceptable. Train your staff on how to avoid phishing, vishing, and smishing. Oh, these are weird words. What are they? Basically, it means that people can use, social media to try and get into your head. We could send you a very interesting email that says, hey, read this. This is very important, very interesting. So you try to get into it, and that opening of the email ensures that they have taken control of your computer and take away your data. Or you might get a telephone call which tells you, sir, we are from so-and-so department of the government, and we want this information, otherwise you shall be barred. Tell him to hell with you, right? Nobody's going to ask you for your secret details through the phone. So please be very, very careful about all these things. Train your staff. That's important. And the right person to do this would be some person who's a healthcare informatics expert. Also, don't forget to ensure that all your staff know that you will take stringent legal action with respect to infractions, so people are not casual about it. Remember, I told you, humans are the weak link. Change processes so that patient names, notes are not pasted on notice boards or which are within public reach. There's no calling out of names, like somebody stays at, sitting at the reception, says, hey, Miss Jenny with the anal pain, could you please go to room number 2? Oh my God, that's absolutely wrong. Call them by token numbers. Just some examples. I'm rushing through, don't have time. And these doctors, nurses, do not discuss patients or records in public spaces like cafeterias, common areas, and so on and so forth. And please ensure private phones should not be allowed in high security areas. Use landlines, because they can use cameras in phones. Every phone has a camera to take away information of the patient. And how do you protect yourself? As if you're a clinician, avoid discussing cases on phone with patients. You may be recorded. Follow protocols. Do not advise a patient on phone till you identify and triage them. Be sure that, okay, he is my patient, and I'm sure that he's the right person, and I will decide whether I should pass the information to him or can I treat him via telemedicine. Only when you're sure do you look at him, or tell him, please come and meet me personally and I shall look at you. Do not discuss cases on social media. That's a terrible thing. People like to, crow. Oh, I've done so much. I had this patient. I did this for him. he had cancer, I cured him. Never do that. If you want to do something educational, make sure they anonymize the patient data. Never casually download software, games, utilities without knowing if they're safe. Never open mail from unknown people. Use spam filters. Do not use online software to provide consultancy to patients. It's a very common thing these days. Unless you're clear, you understand their terms and conditions. Many of these online software, which allow you to give consultancy to patients, simply say that the risk is yours. They wash their hands off. They say, we're only giving you intermediaries. We're only giving you the platform. And even if the platform is absolute nonsense, you will be held responsible. Ensure your laptop or phone or desktop is fully secure and updated. If providing telemedicine consultations, use the telemedicine practice guideline performance software. Take the help of a consultant, obviously. Keep a consultant handy in case you need a quick response. Do not give away data like passwords, account numbers, or even if somebody calls you from some official sounding email or makes a phone call. And anytime you feel there is something suspicious, you smell a rat, disconnect and call your consultant. These are some of the few things you can do. There's a lot more you can do, but obviously this is not that you don't have time to tell you more. So moving ahead, do remember, in this electronic age, the meaning of freedom is also to be safe, secure, and stress-free, right? As a very famous person, Thomas Jefferson, said, the price of freedom is eternal vigilance. Please be vigilant. And before I close, just a few words about what I do. Basically, we provide consultancy for our firm, SCIT Consultant. We provide global consultancy in healthcare informatics, HIPAA, GDPR, so on and so forth. And the AmbuPod, as you can see out there in the picture, is our low-cost clinic, telemedicine node, and microambulance ideal for rural healthcare, which costs just the cost of a Maruti car. So that's us. Ladies and gentlemen, thank you for the time you've given to us. I'm Dr. Lavanian Dorairaj. Over to you for questions. I have finished on time.
Thank you, Dr. Dorairaj. It was a real wonderful presentation and needed. But talking about, hospitals where the influx of patients is so much that they themselves don't know what they're having. Sometimes we have patients who come and give their password saying that you please see the reports. So I think then it'll take a lot of more time for people to understand about this. But yes, in private hospitals where people are educated, I think they would know this. And this is really a very needed one. And I think it's very well put. And many of us didn't even know so many of these rules actually existed. So that was really nice. Thank you.
Thank you so much, ma'am.
Anybody? Thank you so much, Dr. Dorairaj. It was really an eye-opener. And I like the way you redefined freedom. That was something take home. Thank you so much.
Thank you and Jai Hind.